situation in India remains hypercritical.
A second wave that's turned into a tsunami.
A record rise in COVID cases.
Lots and lots of patients begging for hospital beds, for oxygen.
They are hanging by a thread.
Hello and welcome to The Nexus. Today we're looking at how India is struggling to cope with the coronavirus. India's story is a very strange one. It makes more vaccines than any other country in the world, and it appeared to be on top of the virus until it all exploded sometime in late March, early April. Now cases in India are reaching new record highs almost every single day. Where did it all go wrong? India is notoriously crowded. More than 1.39 billion people live here. Its population second only to China with 1.44 billion. But with only a third of China's land, India is nearly 3 times more densely populated and 10 times more than the United States. With people so tightly packed in and with big extended families the norm, you'd think these would be ideal conditions for the coronavirus to spread. And you'd be right. The story is best told by this graph, which shows the number of daily new cases in India over the past year. The first peak was in September, 93,000 new cases per day. But they soon started to fall, thanks at first to lockdowns and then as a result of the vaccination program, which began in mid-January. This sanitation worker was the country's very first person to be vaccinated. Incredibly, India produces 60% of the world's vaccines each year, and its 2 biggest producers, the Serum Institute and Bharat Biotech, have been producing millions of doses of AstraZeneca's vaccine under the name Covishield, and India's own vaccine known as Covaxin. With its own crisis seemingly under control, India began selling doses to the UK and donating vaccines to a number of other poor countries later in January. By mid-February, cases in India dropped to a low of just 11,000 a day, compared to 93,000 at the peak in September. And by March, Health Minister Harsh Vardhan declared India to be in the end game of the COVID-19 pandemic.
COVID is already on its way out.
In early April, India declared itself the fastest country in the world, the vaccine gold medalist, having given more than 100 million jabs in 85 days, ahead of America and China, which took 89 and 102 days.
We've done it in 85 days. Another achievement for the country that managed to, in the first wave, contain COVID.
But that elation was short-lived. From late March, early April, new daily cases started to soar, rocketing past the previous peak in September and setting new world records on a daily basis. The highest new daily case report anywhere in the world since the pandemic began. And now India is in dire straits. Its intensive care units are full. There's not enough oxygen for everyone, and it's unable to vaccinate its own population fast enough, let alone send doses elsewhere. So what caused the spike in new cases? Critics of the government say they're astounded that it allowed millions of people to participate in state elections in February, and then allowed 130,000 cricket fans to watch India play England in March. And then, earlier in April, as this devastating second wave washed over India, it permitted millions to take part in a vast Hindu festival on the river Ganges.
There is no another way, we have to come here.
Or did the government open India up too fast, too soon? Let's bring in our guest now. And in the top left there, we have Dr. Harjit Bhati. He's a doctor at a private hospital in New Delhi. He says the situation is desperate. Javed Ansari is a freelance journalist, also in the Indian capital, says cases and deaths are being grossly underreported. Professor Dinesh Saralaya is a respiratory physician here in the UK who has been coordinating trials of both treatments and vaccines. And finally, Dr. Saira Madad is an epidemiologist and pathogen preparedness expert who is overseeing New York's public hospital response to the pandemic and has been following the situation in India closely. Welcome to you all. We're very short for time, so I'm going to get started with Dr. Harjit Bhati. You're working around the clock to treat people in New Delhi. What are your biggest challenges right now?
Biggest challenge is to provide beds to all the patients, and when they are admitted, to provide them adequately with oxygen and if they need, then to provide them ICU bed and a ventilator. It is the biggest challenge because we are not able to provide beds to everyone, and we have to send back many of the patients who are critically ill, but we were helpless because we don't have beds. So this is a very big challenge of to providing adequate healthcare infrastructure to all the patients who desperately needs hospital care.
Dr. Bharti, back in January, your hospital had just one COVID case and you were preparing to shut the COVID ward. How did it all change so quickly?
Uh, Actually, there was many faults. One is that the vaccination program, which was promoted as a treatment rather than being a preventive measures. Look, people thought that just because the vaccine came, now we win over COVID, and now we won't get infected with the virus. And the second thing is that because the infection was also decreased, very less patients was left, so people also was not adhering to the COVID appropriate behavior. So both these things at the part of policymakers also and to the part of public also has resulted into this catastrophe.
I think everyone on the panel who I've spoken to in preparation for this program would say that India let its guard down. I want to ask you, how important is the leadership from the top? Were they complacent? Did they fail to set a good example for the rest of the population?
Yes, absolutely. Because they were organizing public rallies, means encouraging more and more mass gatherings. There was posters on social medias which were inviting people to attend their gatherings and to involved into election rallies. And then there is so much gatherings about the religious ceremonies. Even the Kumbh Mela was going on. Even yesterday 30,000 saints have taken a bath in the Kumbh Mela, though it was told that it can be a super spreader event. So overall, the policymakers have said something different. Means our prime minister in the morning, he says that everyone should wear mask, maintain distancing, and in the evening he was seen saying that I have never seen such a large gathering in my election rallies, and he was appreciating the people for having a mass gathering. So these dual type of information gone to the public, and which has resulted into a more confusion into the minds of the people, and which can also be a contributing factor to this problem.
Javed Ansari, you're a journalist also in the capital. I understand you essentially haven't left your flat in weeks. You get the food brought up in a bucket and you throw the rope down. You're trying to avoid the slow motion catastrophe outside. I know that you place a lot of the blame with the politicians for failing to set an example, but more than that, you are reporting that criticism of the government is being stifled. In what way?
Well, critical posts on Twitter and Facebook are being taken down. The government has issued an order, has taken a policy decision, and they've asked Twitter to do so. So not just journalists, but even those who forget being critical, even those who are making these putting out innocent tweets, asking for help. In the state of Uttar Pradesh, in Amethi, somebody asked for help for his grandfather. He was short of oxygen. There were no oxygen cylinders. He put out a tweet, and now a case he's been booked in a draconian law. So that's the kind of the chief spokesman of the Congress party. He had his tweet taken down. He has now moved court. There have been filmmakers, journalists, documentary makers who've had their tweets taken down. This primarily stems from the fact that this government wants to control the narrative, and also that it doesn't take very kindly to criticism. It believes in controlling the narrative, and anything which doesn't fall within the framework either needs to be removed or needs to be stamped out.
But you're saying that Twitter, which is based in the United States, has caved into pressure from the Indian government. Is that what you're saying?
Certainly, and this is not the first time.
And what potential damage does the stifling of criticism do to Indian society, and especially in the way it battles the coronavirus?
Look, the main thing is if you don't begin to recognize the problem, how are you going to solve it? Forget the criticism. A lot of this is just comparison, is just highlighting, amplifying what people need. And if the government of the day, the policymakers of the day, do not have the stomach to face this, to recognize the problem, how are we going to solve it? As far as the rest of the people are concerned, look, the overriding sentiment is one of grief and pain. The overriding need is to get a hospital bed or to give their dead a decent burial or decent cremation, both of which are in short supply.
Saira Madad, you're watching events from the United States, and I can see you nodding your head there empathetically. Does this all concur with the reports that you're receiving from India?
That's correct. We have a COVID-19 task force of various clinicians around the United States and around the world where we talk to clinicians, boots on the ground, and that's exactly what we're hearing. The situation is very dire. This is a huge humanitarian crisis for the world to take note of, to make sure that not only are we providing support to India, because that's the right thing to do, but also to make sure that we are having this pandemic under control in any country. This should be a warning sign to us all. If you're looking at some of the reports that are coming out, even comparing it to last year, what you're seeing is last year 1 in 30 infections were being caught in India. So now seeing, over 300,000 cases and over 3,000 deaths, which is a gross underestimate, you're seeing that the numbers are completely off the charts, and it's probably much, much higher than what we're actually seeing in reports. Looking at the prediction model, seeing 13,000 deaths per day at the peak, that's an astronomical number. And so we need to provide some support on an ongoing basis.
While we're in the United States with you, can I just ask you about the US offers of help to India? Raja Krishnamurthy, who is a Democrat congressman, has said last week, when people in India and elsewhere desperately need help, we can't let vaccines sit in a warehouse. We need to get them where they'll save lives. We're currently sitting on close to 40 million doses of the AstraZeneca vaccine in the US stockpile, a stockpile which we're not using and which we've already opened to combat COVID-19 in Mexico and Canada. Is he making a good point? Is the United States being too slow to release those vaccines to India?
So the United States has made a commitment to provide 60 million doses of AstraZeneca vaccine once it goes through the safety review. So that's a great start. It has also provided.
But when will they be released?
So whenever it goes through the safety review, it's an entire process, and what that timeline looks like, we don't have much of an indication. But the raw materials have also been starting to be provided to India to ensure that they have the manufacturing and material capability to increase their supply. Because as you know, in India, less than 10% of the population has received 1 dose and less than 2% are fully vaccinated. So there's a dire need to provide not just vaccines, but therapeutics, PPE, diagnostic tests. All of those things are also being provided through the current administration.
On the question of raw materials, you mentioned that. People are wondering if there is actually an embargo, and we know that US officials have said there is no embargo. It's just that US government contracts come first. Is that the point?
So the DPA, which is the Defense Production Act, has been invoked, and it's just saying that in the U.S. that the U.S. contract certainly will take precedent to provide the resources that's needed, but certainly not saying that you can't export out. So that's just a bit of a misinformation that's been spreading. So in the U.S., they have been able to provide raw material to other parts of the world. And I think one thing just to note on the supply chain, before the pandemic, we were producing about 4 billion vaccines on a given year for flu and routine vaccinations. Now we're developing 14 billion vaccines on top of the 4 billion. So the supply chain certainly is taking a huge hit. So I think it's just important to make note of those things as we look at supply chain and providing raw materials to the world.
US government spokeswoman Jen Psaki says right now we have 0 doses of available AstraZeneca. Giving to other countries is likely weeks away. Is that what we're talking about, weeks away?
It's hard to tell what the timeline looks like. Certainly, I think that support has been provided. It's ongoing. But in terms of how much support is happening on a day-to-day basis, it's a bit unclear.
Professor Saralea, can we just look at what the United Kingdom is doing? So far, according to this government statement, 9 airline container loads of supplies, including 495 oxygen concentrators, 120 non-invasive ventilators and 20 manual ventilators are being sent to India. Tell me, is that nearly enough?
So in this COVID pandemic, we know that no time is late, really. So I think India has to employ a combination. With regards to the help that is coming, it's a drop in the ocean, in my opinion.
Right.
Now, the number of cases that India are reporting I think again is a fraction of the real number. You could probably multiply it into a factor of 10. Now the projection shows that the peak of this wave is probably going to peak around the 17th of May. So they've got another hard 2 weeks to ride. So any help the international community from the expertise. My own opinion is India has to do one of two things, actually two both really. They need to handle the crisis and at the moment, because we are losing lives as we speak, so there needs to be a concerted effort of all agencies. And again, India is a democracy which has more than 26 states. So different states manage the pandemic differently. I've come from the southern state of Tamil Nadu, and speaking to many of my colleagues there, they're doing it reasonably well when compared to the northern states. So, but that is not for now. We've got to try and handle the crisis. But at the same time, India has to deal with vaccination. I think, as mentioned before, the speed of vaccination has to ramp up. You must remember, for a population of 1.3 billion, you're going to need 2.6 billion doses and at least 70% to be delivered rather quickly. But India has the advantage of being a manufacturing hub. So we know that it's manufactured the Covishield, which is the AstraZeneca Oxford vaccine. It has the indigenous vaccine Covaxin, manufactured by Bharat Biotech. And the whole trial, which I led in the UK, the Novavax trial, is also going to be, the Novavax, when it gets a license, is also going to be manufactured in India through the Serum Institute. So now is the time, I feel, is not for blame games. That will come later, and an inquest has to be done. But we need to get through this urgent crisis that we face. Lives need to be saved, and vital treatment need to be delivered.
Okay, let me take you back to the British effort. The British Association of Physicians of Indian Origin is now taking matters into its own hands, it writes, as it believes the UK government's delivery of aid was minuscule and a drop in the ocean. Did you participate in that joint statement? And do you think okay, you didn't participate in it, but do you think their point is valid?
I think when you've got a crisis like this with hospitals being overwhelmed, any help forthcoming by any government, because it's not just the UK which is going to be helped. As we've heard, the US government is helping, France is helping, various other countries. I think the directive has to come from the UK, from the Indian government, and what its urgent needs are. We've heard that oxygen supply is in great demand, and that needs to be sorted almost immediately. The need for ventilation, but also therapeutics. Now, protocols in India vary differently to what we do. For example, in India, remdesivir is widely used, whereas we know that in the West, we have hardly used remdesivir. Certainly in the UK, we believe the WHO guidance that remdesivir is good as placebo, and we didn't use remdesivir. But it depends on what the national protocols, but to support the government in what they need at this moment of time. So all the governments in a concerted effort, this has to be a concerted effort. I think the blame game has to wait.
Thank you for that.
We need to try and save lives.
Dr. Sarah Madad has agreed. You have to go and attend to your other hospitals. So I'll just say thank you for your contributions to the Nexus, and we look forward to seeing you next time.
Thank you.
But we keep three of our guests. Dr. Bharti, back to you. We understand that India produces something like 60% of the world's vaccines every year, and yet just 1.6% of India's population is vaccinated. What explains that number?
This is actually very worrisome when we see this, that less people will get vaccinated, because now we are seeing that people who are vaccinated, though they are getting infection, but the infection is milder than the other patients which are having severe infection if they are not vaccinated. So we were expecting that as the vaccination program was started as a phased manner, it was first given to the healthcare workers, then to the elderly, and then to 45 plus. And now from 1st of May, it will be open to 18 plus to everyone. But it is just means the phased manner was going on, means decreasing the age group and increasing the number. But in reality, the vaccine is not reaching to the people. And I think this is because of the same healthcare infrastructure, because there is a limited number of healthcare workers and the infrastructure is limited. So that's why not able to provide sufficiently to everyone.
Can I ask you about the new variant in India, or relatively new variant? I mean, the double mutant known as B1617. Did you say that in your experience, it has built up a sort of a resistance to the vaccines that are currently in circulation?
Yes, most probably. because we are seeing patients who were infected last year, then they also received vaccine, 2 doses of vaccine, means completed doses of vaccine, and still they are getting infected with the new virus. So definitely this new virus means this new variant is obviously has learned to dodge all the means that changes give that the immunity given by the vaccine and by the previous
Is it
infection,
more
and
deadly
it is
or is it equally deadly?
means if we will compare to the normal population, means I'm not talking about the vaccinated or non-vaccinated, otherwise normal population, if I am comparing to the previous infection, last year infection, so this year we are seeing a more severe infection in even young adults and fully like immune like healthy individuals, we are seeing a severe infection. Last year, in my observation, mostly the infection was in the elderlies or in the immunocompromised peoples, and this means the severity of infection was in the vulnerable age group. But this time, even the healthy individuals are getting severe infection.
Professor Saralea, if I may ask, the British government put India on a travel red list, if you like. Do you think that was the right decision?
I think it was the right decision because I think, especially with the UK, with the level of infections that we've managed to curtail, and I think the UK has done it with a combination of a very strict lockdown and a vaccine rollout unparalleled to any other country. And the last thing you want, I think certainly the AZ vaccine is pretty confident that it will deal with the strains, because the problem we have, as per your last speaker, genetic sequencing in India, as per unlike the West, is very sparse. So you're actually, though you have a double mutant, we have found that most of these mutations take part in the spike protein. And most of the vaccines, and there is some early data today that the Covaxin vaccine in India is capable of protecting against the double mutant strain seen in the Indian variety. The level of protection depends on what vaccine you look at. It's anything between 80 to 90%. Now, as quite rightly said by your previous speaker, is that what happens when you get 2 doses of a vaccine as opposed to 1? With 1 dose, you certainly get a milder infection, but the aim of the vaccine is not to prevent infection, because vaccines produce a systemic IgG response, but do not produce a secretory IgA. That's very important for your viewers to know. So you can still transmit the virus till we get oral therapeutics which deliver protection to the mucosa. So vaccines will not prevent transmission, and there is some early data with the AZ or the Covishield vaccine prevents that, but that needs to be studied further. But with regards to the mutations that we're seeing, most of them occur at the spike protein, and to this date, there is no data to suggest that the vaccines don't tackle them. That includes the AZ vaccine and the Covaxin vaccine, and there is some data produced by the Indian scientists looking at the Covaxin vaccine that it is effective against the Indian strain.
Javed, just to bring it back to India, we're beginning to wrap up the programme now. We've seen pictures of makeshift funeral pyres. Can you tell us about that and what this is doing to Indian society?
Well, it's having a very detrimental effect on morale. Everybody, the overriding emotion is one of fear, of anguish, of pain at the loss of near and dear ones, and fear at what this holds for the rest of us. Because when there is a big rush. The biggest irony is that those who are unwell can't get to hospitals, and those who are dying cannot get to crematoriums. So despite everything, you may have all the money in the world, the connections, but there are no hospital beds. There are very few beds with oxygen cylinders or ventilators. There's limited access to life-saving medicines. So at this moment, the overall feeling is one of doom and gloom. And what we fear, and based on government projections, is that the worst is yet to come. So we do hope that our government and the world will be able to put in place, augment infrastructure and ensure that as many lives as possible are saved. Because this, without doubt, is the darkest hour in India's history. This is the biggest calamity we have faced, and we'd be grateful for all the help that we can get.
Dr. Bhatia, I'd like to just conclude with you, if I may. Of course, you're working around the clock to help people at your hospital, but you've made time for this interview. What is the important message you're trying to get across to the world?
message is that the COVID is not over yet, and people should be adherent to the COVID appropriate behavior. And even if there was no infected person around you, still wear mask and take this virus seriously, because this virus learns very rapidly learns about the mutation, and it can be very deadly if it occurs anywhere in other parts of the world. So everyone should stay safe and follow COVID appropriate behavior.
Dr. Bharti, Javed Ansari and Professor Dinesh Sarulaya, thank you all very much for your contributions to the Nexus today, much appreciated. And thank you at home and on your phones for watching. Remember, you can see this or any of our previous episodes on our channel on YouTube. Just type in Nexus at TRT World. Till next week then, goodbye.